and guiding us from long time. He has a great clinic in London, Croydon. He is preparing all medicine himself. Generally, he is avoiding to purchase ethical or proprietary. He is making his medicine directly. So we would like to welcome all of you on behalf of AYUSH Samriddhi International Webinar Series at milestone of 2938 on the topic of rheumatoid arthritis. Our beloved, respected Ayurvedic expert of UK, Ayurveda Ratna, Dr. Avtar Singh will guide us, who is renowned herbal medicinal practitioner as well as founder of Siddha Ayurvedic Academy and Research Center. Thank you very much, sir, for your valuable consent to bless us. Respected Avtar sir, welcome, sir.
Thank you very much, Pawanji. I was listening from our Sri Lankan friends, and Happy Independence Day, and I don't know that one. And what they're talking about the cancers, that one, they're doing work on the cancer there. It is a great job. They're doing some other researches, and they're inviting. That is very good opportunity for public who are suffering from cancers. Congratulate to them. They should be work all together. And you've done so many programs on the cancers before. We also spoken on that one. Any disease nowadays is critical. Rheumatoid is also same thing. A lot of people are suffering. As a researcher, what I found in the reason of rheumatoid reason of the joint pain, gout, they not start in the one day, they take long time. What is my recoveries, my patients recovered from rheumatoid is, I sent you some videos before last time. If you can show, you can show. I have so many videos from other people, so many testimonies. My treatment style is completely different. I'm not keen to spread the so many medications already in our Ayurveda system, hundreds of medications. Last time I also told for the pains, rheumatoid. It's not the new problem, this one in the body, but nowadays too much. So many people, at least 10-15% people are suffering from rheumatoid properly. But 20-25% they are going to stage 4. Some is stage 1, some is stage 2. Nowadays, so many things related to the pain. But problem is why our joints start giving problem to human body. I'm not work only what treatment we do it. As I told you, thanks very much, you explained of my treatment style. I do custom-made medications. I believe after so many successful treatments, many type of nearly 50-55 autoimmune diseases I reversed. Rheumatoid is also autoimmune disease. One thing, I think, very great name In Ayurveda, we never know, nearly 30, 40 years ago, people don't know autoimmune diseases. Now everybody have the good excuse, I can say. World Health Organization or pharmaceutical company, or doesn't matter who's done this one. So many things are coming on, so many things are, they say this was good, this one good, this is good, and after 10 years they change their statements. Only Ayurveda therapy, only Ayurveda system is never changed. It's written in the 5,000 years ago for coming when the humanities came in the world. Unfortunately, our Ayurveda, modern qualified people, I say now, they are thinking, following, and believing what allopathy researchers are saying. What allopathy, World Health Organization, what pharmaceutical companies are saying. Three things I noted today. First time I said this one in your program. When I talking to the Ayurveda people, when I discussing with them, they are too much try to tell them everybody's Ayurveda practitioner ask the question very similar. What are you using for the chronic diseases? My answer very similar, very same for everybody. It's not mean I don't want to share the treatment. Believe me, this is 100% time. But I always say, do you know what is the actually problem? 95% Ayurveda practitioner, doesn't matter anywhere they're doing, they are following allopathy system. And their question was same. Many people I know, I telling from last 10 years to them, they say, we tried, which one thing to, you can discuss with me. I don't need anything. I always say, come we work together, come we research together. If you need help, just until you not diagnose properly what is the reason, for example, any disease. Allopathy is confused. They make the one drug, after 10 years, they say, no, this will have a lot of side effects, you have to stop this one. They make the one vaccine, after that one, they say, this vaccine gave a lot of problems. Why Ayurveda people are following that? We have our own science. That is very great. No one can beat this science. Many times I say, you know, the allopathy, the following is the Ayurveda. In the surgery, in the blood check, they also say, oh, you want to blood check? Come nil to mouth. Whose system this was? This is Ayurveda system. In old time, Ayurveda doctors, Ayurveda Veds, doctor is English name, Ved is our Sanskrit names. They say, come before the even sun is rise. Why? If we don't want to listen, if we don't want to follow what is Ayurveda saying, take a little bit Ayurveda, what you want, you'll never be successful. It may be harsh word, this one, but you never be successful. You always struggle. Follow 100% Ayurveda. Ayurveda saying, you want to check up your nadi, pulse reading, come before sunrise without eating anything. That time, your tongue, where they can see properly, your eyes where they can see properly, pulse is what is your pulse that time, never in the daytime same. That Vat, Pitta, Kapha, what is those morning time before sun is different than Vat, Pitta, Kapha, every day changing, every time. Everywhere they know, I don't need to explain too much. They know before lunch what is there, after Surya half day, night time, what is the Prakriti? What is the Vat, Pitta, Kapha? Prakriti telling us what I have inside now. Why not be following that one? Until they don't follow that one, they not get the result. They can't make the nice medication. They can't make the nice formulation. They can't do the proper treatment. Any disease, what to say. If I am successfully done 50, 55 diseases, so I follow 100%. I'm very strict on that one. There's other language. Sometimes it's hard to, no one can come early morning. Then I said, learn the symptom language. When you're telling the patient, first thing, I never told any my patient, your Vata is high, your Pitta is high, your Kapha is high. That is only for the practitioner, only for the Vaidya who know what they are and how they work, how they mix, how he can or she can balance. Our Vaidyas want to show off, tell them they are very great. Oh, I told him, oh, your Vata is high. They believe on that one. They do so many mistakes after that one. Our people are very clever, but mentally they are not clever. They want to do everything then after that one. Then they make the Ayurveda name bad. Oh, I try Ayurveda medications 6 months, 4 months, 3 months. They not try Ayurveda medicine from the professional. They are self-diagnostic people. That is an I tell every friend who doing Ayurveda. Number one, you should know what is inside. Don't confuse the patients. If you don't confuse the patient come to you, then you are responsible. See that one once you do. If you taking Nadi Priksha after the morning, anytime, you should know the symptom of that disease. I have with me the people here, they seen with me when I go there, and I always mention their name because we are one team here. I never say to any my patient, Dr. Joshi, Dr. Raghunandan, Dr. Kapil, these 3-4, we are working together. I never say you are Vat, Pitta or Kapha, what is the out of control. I tell them, do you have this symptom? Do you have this symptom? Do you have this? When I say, they say yes. I told before Dr. Joshi said, no, you've done some kind of siddhi, that isn't you don't know. I said, no. You have to be control on your mind. You should know what is the Vata symptom, what Vata Kapha system, Kapha Vata system, Vata Pitta system, Tridosh system, Dvadosh system, single dosh system. If you don't know what is the body reaction, then we can't do the medication. I done the study, not only Ayurveda up to there, then I study more. What I found, how I getting the result, because I study not only the organs. When I was Gurukul, they study organs. They teach us control the organ, root cause jisko bolte hain. Until you don't know the root cause, which kind of organ is giving problem. Organs are related to each other, but who was the main culprit? And after that one, when I study the gland system, endocrine system, I work on that one too. I combined both of them. Result become marvelous because when I study more, then I find all the organs are useless if our glands are not working. That is the system. Allopathy done very great things, many things done very great. I always appreciate them, what they done. But Ayurveda now is a problem. They done great system for the checkup, diagnosis system, but Ayurveda practitioner should do the practice similar like them or study what they done, not to be shy. I openly say, I combined Ayurveda and allopathy studies. I don't have to shy. We have to appreciate them who done the good job. We have to appreciate them. We have to follow their. Ayurveda people don't want to follow properly, but they thinking that way what Ayurveda saying, allopathy saying. Allopathy saying, oh, these are the autoimmune disease, they are not curable. That is their say. They made life easy for the doctors, GPs, and make easy life, easy money for them, for the pharmaceutical company. Now every allopathy doctor say autoimmune diseases are not reversible. So only you have to take the steroid, painkiller, and antibiotics. The permanently, like you need the Miller start age of 30, 25, and until you die, you taking mineral vitamins every day. I don't believe it. If your health is okay, doesn't matter you are 80, doesn't matter 70. Our body, if not observing from the food any mineral or anything, they're not taking. Our body system should be observed. If our bodies, every food, everything, they have the all mineral, everything. You have to choose what kind of you need. If body not observing natural food, how can they observe synthetic things? They're more hard to body to observe that one. We not understand. That is Ayurveda saying. Ayurveda is most thing they say diet is most important. Time is most important. Medication only work. Doesn't matter Ayurveda, doesn't matter anything. If they have your diet is okay. When the allopathy, they don't know the diet system. They know the diagnosis system. Ayurveda don't know the properly diagnosed system. They have the diet system also, they don't follow properly. Now, these kind of, before the cancer, all the cancers are very similar problem. Cancer is, yesterday I have some patients came, I discussed, they asked me this very similar question. I told them what is the cancer when I research. First, my research was on the cancer. After that one, now I tell the autoimmune disease is very much similar that one. Though your person is very much similar, suffering his whole life. Why the pain in the joint, in the muscles, everywhere is come first, they say gout. After that one slowly become the rheumatoid arthritis. Then all the fingers, all the joints are becoming swollen, inflamed, and also becoming out of shape. Why? What is the reason? Then you give any medication, not work properly easily. I'm not saying many people in Ayurveda, they're doing great job. But not why everybody can't do it. In Ayurveda, we have so many medication for the pain, so many medication for the joints. But why those kind of the joints become the inflammation when they are out of shape? Not only out of shape, their joints, bone are damaged that time. Many times I say, what I found, inflammation then become infection. You have to treat both. If Ayurveda person is very intelligent, proper, is experienced, they do both way. How can you make the circulation on that area where the inflammation, where joint is out of shape? How can you send medication there? What is the reason those can come that one? not only Vat rog. Yeah, Vat or Kaf both is joints in that area. They are the blockage, not a single dosh. And many times tradosh. Depend on the what is the reason that joint pain come. There's many people have some other health issues. You also have to treat those health issues with that one. It's many people in Ayurveda say if somebody have the gonorrhea or syphilis like STD disease, they definitely later on get the joint pain. If somebody have the diabetes, they also can get a weak that one. Women are most suffering for this one after the menopause. They're taking so many before, they're taking the pills that one. Now no one giving the pills. Last 40 years, hormone replacement therapy, which one? Why not they giving now? They are changing this, but Ayurveda is not changed. Please follow the Ayurveda properly, and only you can treat rheumatoid arthritis if you first find out what is the reason of the rheumatoid arthritis.
Yes.
What is that reason also you have to cure. Ayurveda have so many medication. All the Ayurveda people, all the Ayurveda practitioners, they know. We have nearly 30, 40 Ayurveda in that one. Make it properly, number one. That medicine, which one you using that one, make sure that is made properly. If that is not made properly, not name. I'm openly say I don't bother what people think. Many companies they are making too much substandard medication. Their standard is very, very, very low. If they making properly, and most of Ayurveda medicine not hard to make. If you want to do the practice your own, make your own medication, you can see the result for that one. And if they more than single dosh, rheumatoid arthritis, most time more than single dosh, dvadosh or tradosh, balance that dosh, bring them normal on that one. If their age, you also have to look after. Then make custom-made medication. Everybody know what kind of ingredients they use. Sometimes we have to less ingredient, sometimes to give them more ingredients. Make the classical formula and add some other ingredients with it as a powder type. I do that way. That's the reason I'm getting good result. That is on the. If you want, I can tell the so many, but I'm not say take it without any professional. Many people say, "Oh, I can say that all the Ayurveda, many Googles are they made it for that one." Amar Sundari Bhatti, that one. Mahayogaraj Google, Lakshadi Bhatti, Abhay, the Turdoshang. These are all for that one. They can work only when you diagnose properly. If you have the too much toxin inside it, remove the toxin from the body, let the blood reach that joint properly. Only that joint are inflamed or infected because blood is not reaching there properly. Should we make also blood purify? More blood purified, more work better. More have all the oxygen inside, more when the infection come, that is definitely that area infected. And what does the mean infection? Means some kind of the parasites there. In our body, we have the ashes. That is I designed the Saptakarma. Why I design? I don't need to design that one. I can use the Panchakarma. No. For full body, other area, take which asha is not working properly, you can very easily find. You should know which asha is related with that one. When you do that one, you can see the result within 2 weeks. I'm telling you, this is one case, I can't put her name. before I told this word, and from last case which one I'm really surprised what I was saying. I told 4 or 5 patients, can you do it for me, this thing? They are too shy to do it. But that patient, I told, and that person follow my instruction, and that patient told me, yes, what you saying, I seen inside when the waste come from the body. No one helping me with the research. Even I told so many Ayurveda practitioners, come on, we work together. But no one want to work together, but they want to, what I'm using. I'm using every patient different thing. Make the traditional style Ayurveda, as you said, this one, what we was doing 50 years before, 60 years before, Ayurveda results still can come. Any kind of disease we can reverse it, depend on how much body is damaged, maybe take little more time. Don't compromise on the medications. Don't compromise. If you don't know, learn that one. Ayurveda still is the best, can give the result within 2 weeks. Like I said, that person after they took first time only 1 week medication. He said, I want to see the 1 week. After 1 week, I have the report I can share with you. 1 week after that one, after that, no, I want proper treatment now. Proper cleansing now. I done that system is, I not done give the medication for the pain of the joint. If you're giving the medication to reduce the pain, that medication only, no. You have to make the circulation on this. Until circulation is not there, doesn't matter what you use, doesn't matter what cream you use, what ointment you use, what doesn't matter what painkiller you use, they can give the temporary relief. Rheumatoid, osteoporosis, any kind of pain, anywhere. I treated so many people, they done so many injection in the steroid injection, that one, they need the surgery on that one, but they saved their surgery time. With the Ayurveda, what is my style, what is my therapy, which way I'm treating, finding out what is the reason, that one. If the cracks inside or bone is rubbed too much, then definitely that information not go. You have to be protect that. We have the so many. We have the Lakshya Google. We have the Abba Google for that one. It's work very well if you made properly. If you not made the properly, buy from any stupid company. I say, I'm not happy with them. I'm really very angry the who making a medicine bad. Okay. If I am in the Ayush ministry on that one, I can close them in 24 hours or make them properly. Otherwise, they are in big trouble. We have to be Ayush ministry support. They have to be looked after properly if we want to Ayurveda and go in the world and help and relieve the problems from the world. We have to be not only learn more Ayurveda, which way we have to make the more researchers, they work together, then discuss together, then all our colleagues listen to each other. Don't listen only what the world other therapies saying. We have to be stick on our Ayurveda, what Ayurveda saying. I'm not leaving Ayurveda, not only thinking what other words say. But if they're saying good thing, understandable. But as I said, they are very best to the diagnose. What the literature they made, why the problem, symptom language you can learn from them. Even we have the Lakshanat in our Ayurveda, but not like them. I honestly say to this one. But which Ayurveda I learned that time, those books are not available now anymore. Those books are not available anymore. I never seen, I try to buy for other people to tell them, make the, I even ask I know the who print that one nearly 120 years ago. I have the book more than 120 years ago, that one. So many people say when British rules come in north, that area, the stateway destroyed all the system of the Maharaja Ranjit Singh made that one. maybe some other area also. I heard that one Siddha Ayurveda in the south, they are very popular. Still people doing, because they learned from their parent, grandparent, great grandparent. They learn from there. When the university came, they don't bother those people. And we have to be come together, listen together, work together, and research together. And if any doubt of anybody, what I'm saying, I can explain to them, I can make them satisfied. If you want rheumatoid arthritis only, not any kind of pain. I done fibromyalgia too. The only come because where is the more than one dose pitta or vata and kapha is stuck that area. That's the reason pain. If you clean your body system, not only stomach or not only colon, full body, then everywhere from as soon as you remove from the extra kapha or vata start working, vata is stuck. Kapha is dushit, like I last say. That is culprit for any disease. Vata is not culprit. Vata want to move from that area, but they mixed up with that one. They're fighting each other. If we do that one is we can give the lot of relief to the rheumatoid arthritis people. Any kind of pain they have, that one, but we have to find sometime we need the massage therapy. It's very good massage therapy in Abhyanga or anything. The person should marm therapy. We have that one in Ayurveda, very great, very old therapy. We have to make the pressure point on that one. But before that one, if we make the system workable, then you can get a very good result. And rheumatoid arthritis, if they're not gone to last stage, very quickly can reverse. But if they gone to last stage, any disease, I say, but you still can make the patient's life livable, relief, relax. Like I have only one person I mentioned before. I send you the videos of Margaret. She is 99 plus, 99 and a half year old. And after 40 years, she have the mobility, walking without the stick, and start peeling the apples, start making the painting with the pencil, not with the brush. She had the also Alzheimer from 15 years, gout and rheumatoid arthritis, so many cancer, so many, she had the problem, but she start walking. Many years she was on the bed only. So I have the experience. I'm sharing with my experience, not asking to send it to me, that one. I not bother. I can't give the treatment a whole world. Your program is going to everywhere in India. I know many people they don't bother because you're giving them free this one. So, but I appreciate you listening to me, you believing to me. And if we want good result from the Ayurveda, not my thing, we need to be more research, because nowadays, as the lot of problem which one we never suffered before 50, 60, 70, 80 years ago, they have, or maybe one in the 200, 300. Now 15, 20, 30% people are suffering from the joint pain. Some they diagnose properly rheumatoid arthritis, other pain. No need to be worried about that one. If you diagnose properly with Ayurveda, then definitely Ayurveda can help them. Any Ayurveda practitioner can do that one. But if follow my way, what way I am successful, as I told some, that is the classical work. But which one you are giving to them? But before you give them, you have to detoxify the body. If you detoxify the body, and same medication, if you made properly, that definitely work. Okay, no need to waste time on the remedies. Remedies are people listen and use themselves. That is not good way. That is the reason Ayurveda people, after that one, self-diagnosed people, damaging our Ayurveda. So I'm not giving publicly. I always say very strictly, go to Ayurveda professional. If he can't find what is your problem, leave that even professional, like me. And if Ayurveda practitioner did not give the result on any stage of any problem within 2 weeks, he should not give the medicine after that one, like I'm doing. He can try 1 or 2 weeks. Doesn't matter. If that stage, on the last stage, I can give the result, he also can give the result if he know the job. Ayurveda is not like a game. Ayurveda is proper science. We have to learn proper way. We have to do proper way. Thank you very much. If any question, I'm happy to give the answer back. Thank you very much.
Thank you, sir. Thank you very much. बहुत बहुत आभार आपका, बहुत बहुत आभार. मैं आप सभी को धन्यवाद देता हूँ.
Thank you very much, sir.
और आदरणीय डॉक्टर सीपी शर्मा जी को आमंत्रित करता हूँ उनके वोट ऑफ थैंक्स और कंक्लूडिंग रिमार्क के लिए. स्वागतम स्वागतम. सीपी शर्मा जी हैं तो?
हरिओम
हरिओम हरिओम.
डॉक्टर अवतार सिंह साहब को बहुत बहुत साधुवाद.
Thank you, sir.
आम बात आयुर्वेद में सर इस बीमारी को हमारे यहाँ वात व्याधि के अंतर्गत रखा गया है. और जिसमें आम और वात